Facelifts got a little bit of a bad reputation back in the 1980s, and I think the reason for that is that people were getting them too young. It was the only thing that we had to offer back then, and so a woman would come in at around 40 something, have her first facelift. It would be good for about 10 years, and then she would have a second one around in her mid-50s, and then a third one possibly in her mid-60s. And that's when people started to look a little freaky and over-pulled and overdone. But I think if you can wait to have a facelift at a time a little bit later, maybe towards the end of your 50s, mid-50s to early 60s, that you have one facelift done, it's done really well, and then you can maintain the results down the line with a little bit of fillers here and there. I think the results can be beautiful and natural, and you can have a result that doesn't look overdone or over-pulled. A facelift is a surgery which we do either with local anesthesia and a little bit of sedation, or some patients choose to go under general anesthesia. It is an incision which is made just in front of the ear here, and then it's tucked back behind this little piece of cartilage and curls around underneath the earlobe and ends in the hairline. And through this incision, we lift the skin up until around here, tighten the tissues that are underneath, the set of fibrous tissues called the SMAS layer, and then redrape the skin upwards and backwards and take off the excess. Facelift scars are quite subtle. The face scars very, very well, and normally ends up just being a fine, fine white line that you have to look very hard for. It normally blends into an existing wrinkle so that it's barely perceptible and well hidden with a hairdo that covers the incision in the back of the ear. How long do the results of a facelift last? This is an important question and one that should be considered when choosing the time of your surgery. A facelift should last somewhere between 10 and 15 years. After the surgery, your face will continue to age slowly as it would if you hadn't had the surgery. So you want to do the surgery at a time where you're really going to get the most out of the operation and you're still vibrant and enjoying life. Some people will choose to come back and have a little revision, a mini facelift about 15 years later, just to tighten the neck up a little bit more. And others can maintain their results with a little bit of filler as time goes on. So what can be done for people that feel the signs of aging beginning in their face, but they're not quite ready for a facelift yet? And in the time we live in, we're actually very lucky because there's a lot of tools that have been developed over the last 30 years that can contribute to anti-aging without surgery. And I think it's really important to use these tools as much as you can in order to delay the surgery until a moment where, it's really only surgery that's going to be the good solution. So what can we do in the meantime? You can do Botox for lines that are caused by muscle movement or expression. Fillers can be used to add volume in parts of our face which can lose volume over time, like the cheekbones, or to redefine the jaw. Fillers can also be used to camouflage the signs of aging, like the development of this crease here, the nasolabial crease, or the crease at the corner of the mouth. And so these are little tricks and tools that we can use to sort of delay the facelift until a moment when that's really the only option. And normally the determining factor of that is the neck. There's not a lot of great tools out there to address skin excess in the neck. So when someone starts to get bothered by folds and banding in their neck, that's a time when we start considering surgery instead of non-surgical options. A facelift is actually not a very painful surgery. But it does involve what we call social downtime. So there's some swelling afterwards, that can be a little bit of bruising, and there are stitches that are quite visible in front of the ear for the first week or so. So it's not a time that you really want to be out in public or going to a party, most certainly. Once the stitches come out, there's still a little bit of swelling and healing that needs to happen. And normally at 3 weeks, the scars are evolved enough that you can put a little bit of a foundation on them, or bring your hair forward and not have anyone ask you any awkward questions. So 3 weeks is what I tell people before they're ready to re-engage with society.